Greetings again, this is Dr. Bill Wyatt with the American Orthodontic Society, and I want to show something today on Class 3 surgeries done by removing lower 6-year molars down here if they've got lower wisdom teeth and second molars. We could come in and take out the lower 6-year molars and treat a case and get a result that is very similar to a surgical removal of the maxilla and working. I have scrubbed in on surgeries and worked with old surgeons to help do a double jaw case, where we took the maxilla loose up here, shortened it about 10 millimeters, and put it back in, and worked on this lady from 7 in the morning till 1 o'clock that day, and did a lower jaw surgery and also a genioplasty on it. And it made a tremendous difference in this woman's appearance. You just can't hardly visualize without seeing the difference you can make. And then I thought, this is a tremendous amount of surgery to accomplish this. And I've been able to take lower 6-year molars out on a whole bunch of cases and get a similar result without the surgery at all. And now this is going to shake up the surgeons if you take this and look at it and see if there's any flaw in here. And I want to send this to the American Dental Association to study this. If this is true, then we should take this and teach it to people rather than doing this much surgery in here. So let me get going on this case now. I'm just going to show I've got the whole solid case. You can look at everything on it if you just go into the videos on this. And I've got about 7 or 8 or 9 more cases like similar that we've done, and show you what it comes out. This was the way this young lady looked when we started. And this is the way we look as we finish the case up. This is the third deal. The Pagodian, I thought we were going to have to take this back, but after I got through with it, she didn't need it. But the teeth, the lower anterior teeth, were way out here, and we brought them back in. At the same time, we pulled these teeth forward, and I put a lip bumper up here and push the teeth forward, which would do the same as we were doing a surgical case like that. Now here are the models. These are second and third molars here. And we took these teeth and brought them up by pulling backward on this. And we can also, when we got these lower anterior teeth, in other words, the bicuspids and everything together. I didn't have to do it on this case, but you could pull these where you look, where they're in the best position, put a pin in here in the cortical bone, and you hold these teeth where they are. And now you come off with class 3 elastics, pull against that, and bring the upper teeth out where you want them, and get a similar result that you get by doing upper and lower jaw surgery. Now you cannot, in doing this, like we took this and cut the maxilla loose up here and shorten this a good bit, you can't lower, in other words, get rid of the extra length in the lower third of the face doing this procedure. But where you don't have to lower that, you could treat these cases by removing the lower 6-year molar, bring these teeth back where you want them to be, put a pin in the bone structure, and now kind of wear elastics off of this and pull against this, and this won't go back, and this can come forward. In fact, you can, in bringing these back to where you want them, you can do it by using class 3 elastics, and when you get them there where you want them, you pin it, and then you can continue to pull on it and bring these teeth out where you want them. So you can watch this take place as we go through this case. Now here the case is, this is just a little close-up deal of it. Now this side of the mouth, we didn't get it back, or it relapsed back. This is some, that was 010, and this started out February of 87. It'd be 13 years, and then we are now in 2020, we're 24 years into this generation. Now we'll show you put all that together, and it's from here to where we ended up with 2024. It's 37 years from this, from when we started this case to where it is today. Now the other side is fully class 1. It slipped out on this side right here over this period of time. All right, this is on the way. This is after we finished the case. This was off center at that time, just slightly. And here is the other side. It's fully class 1, and you can see this is more narrow. We widened the maxilla. We took this tooth out. We pulled these back to where we wanted it, and then we held it there. We didn't have to put pins on it, actually. We pulling this forward, worked out. Now here it is, an 040 wire. We expanded the metal here. Okay, we're getting a noise from somewhere. Anyway, if you excuse that noise, here we are in 10, but then I've got pictures of this lady just a few weeks back, and you'll show you that at the end here. Now we had a job turning this tooth around right here, but we got it turned and fixed up there. All right, now here we will show you, this is after we finish the case. This is back here. Now when we started, the begonia was there with these teeth were forward. We moved those teeth back, and left this out. I thought we was going to have to take that back, but it looks great without it, without the genioplasty. Here is 1987, and this is about 010, something like that, and the profile, and you can see where it is there. And that's looking at the face, 1987, and then 010, some month in that. And there's the teeth. The midline is right on the money right there. Now, this is 010, and this is 24. In other words, 14 more years later. She's changed the color of her hair. But this is a lady 37 years from the time we started this case to this. So this holds up. Now, if you didn't get it to stay there, we've got retention that would hold it in this position. And this is this is 14 years later from here over to this part right here. And I got these pictures. Some a lady sent it over to me that here in Glen Rose, she's a good friend of ours, and so she visited them and she took her picture of her. I told her I was looking for her. I wanted to take a picture of it, and that's her. You look at her eyes. I mean, look at the difference. This is no question. This is the lady, and that's 14 years. She's sure holding up good, and you can look at everything about her face, even this little deal right on the face. There's no question. This is the same woman, and we did this case by taking 6-year molars out down here, pulling these forward and pull these back a little, and then pinning. You can go in and pin it, but I didn't even have to pin this. And you can stop that and then come off with class 3 elastics and pull the other jaw forward where you want it, and then hold it down. And if you can, now, here again, this young lady went to 2 or maybe 3 old surgeons to see about doing that. And they were going to do surgery on her naturally. And I don't want to get a fuss with old surgeons. I have had some wonderful experiences with them. I've even scrubbed in on some of the cases. And the old surgeon would come to my office and work up the case. And I've done several cases with old surgeons, a whole bunch of them, in fact. Not that many, because we learned that we could do it without the surgery. And the price of double jaw surgery today would probably be $70,000 or $80,000 going in there to do that. Whereas we did this case by just doing the orthodontics and added a little bit to it. It took a little longer to do it. She had a periodontal disease, and she takes care of it better with that. But this is the result. And I want to send these cases, there's about 7 or 8 cases, I will send these to the American Dental Association, and somebody go in there and study this. If I am correct on this, this would reduce a tremendous amount of surgery that's done. Now, if the vertical is down, way down here, you can't shorten that, whereas in taking the maxilla loose, you can cut the bone off and bring it up higher in there, but that is a tremendous amount of surgery. And this is done. So this lady went to, I know 2 old surgeons, she said, maybe 3, and they all wanted to do the surgery. And we figured we could do this, and this was 37 years ago we did this. And that is not the first one we did back then. We've got a whole string of them there you can look at. If there's something wrong with this, I want to find out about it. If it's not wrong, then we ought to change the way we're doing double jaw surgery. In other words, people can do this, and this works. And I want to pass this out. They can check it out however they want to. I'm not trying to pull anybody's leg on what we did here. So look at it and let me know. I would like to see this relieve people all over the world that are doing this type of work, that you can do with non-surgery many of the cases that you would need to do surgery on. And I've got one young man that had too much vertical. I told him he needed to go, but he said, if you don't do this, I'm not doing anything. So we did it, but we did not shorten the vertical dimension of the face. So thank you for watching this, And I hope that people wake up and see that you can actually do a similar thing by treating these cases non-surgically. And the price of this is nothing like would be. And so people the insurance companies ought to look into this. If they're paying the insurance to do this double jaw surgery. And so look into it and you check it out. If I'm not correct in this, I'll change it to whatever you say or whatever is correct after I check it out. So I thank you for watching, and then go and look through these cases. So thank you, and I'm going to hang up here and we'll close out.